The Evidence Implementation Training Program is a very practical, hands-on program where participants undertake an actual implementation project within their health organization. We support them. So we have JBI facilitators who support the participants. They are experienced evidence implementation methodologists. So with the Evidence Implementation Training Program, it covers the 7-phase JBI approach to evidence implementation. So the program is really focused on context analysis, facilitation, and evaluation. The Evidence Implementation Workshop, we provide participants with foundational concepts about evidence implementation. So we teach them different theories, models, and frameworks, and also proven strategies for facilitating uptake of research evidence in clinical practice. We also teach participants how to use a software called PACES, which helps them conduct clinical audits more efficiently, and within that software is what we call a GRIP framework, where it takes them through the process of identifying barriers and enablers, as well as develop strategies to address those identified barriers. So at the end of the program, participants are able to design as well as conduct evidence implementation initiatives for quality improvement and for making those meaningful changes in clinical practice. The Clinical Leadership Workshop, for that program, we provide participants with change management skills, strategies, as well as leadership capacity, so they can facilitate sustainable improvements within their health organization.